Let's go firstly to Jamie Jenkins. He's a former statistician with the Office for National Statistics, and he joins us right now to talk about, well, some of those figures that we are likely to hear about. A very good afternoon to you, Jamie.
Good afternoon, Julie. Are you good?
Very well indeed. I want to talk to you first about the NHS, because we're told that they are going to be getting, the NHS get like another 30 billion. I mean, I don't know, why not just make it 400 billion? Why not just keep spending the money to help with the waiting list? But the latest stats suggest that actually the NHS isn't going to hit its waiting list target.
No, so I think they've had this target to try and get the percentage of patients seen within 80 weeks, around 92%, Julie. It's been a target for a long time now. Now, if you look at where we currently at, it's about 60%. And if we take back to the last 15 years, in 2007, we were about 60%. They did manage in a couple of years to get it back up to 90%, but we're in a slightly different place now in terms of where the demographic of the population is. It was 95%, so it was over the target in 2013. But it's fallen back from 2018, so the back end of, say, that the Tory government decided falling down.
But this isn't. But crucially, this 18-week target, it's not to be treated. It's just to getting referrals to be seen by a consultant. 18 weeks is about 4 months. Imagine you get a referral because someone thinks you've got cancer, and you might be seeing your first appointment with a consultant in 4 months. Every 2 weeks that you don't get treatment, not just seeing someone in an office, you don't get treatment for your cancer, contributes to your chances of dying of that cancer. This is literally condemning people to death, this policy.
Oh, totally, Julia. And this is the type of target that in a country like the United Kingdom, you should be aiming for 100%, not 90%, 60%. It should be 100%.
Don't worry about you lot. You won't get seen in time and you won't get your treatment in time, but never mind, That's how things roll. We're a first world country with what, the 5th biggest economy, 6th biggest in the world. Surely we should be able to manage this.
We should do, Julia, and I believe they're going to announce kind of a real terms increase in spending. So you're saying, another black hole you talk about the black hole the Tory government left, the NHS giving money for there.
But we've given a lot more money to the NHS in the last few years. Yes, of course, there was COVID and all of that. But even then, since then, we've had huge, big sums of money going in. But we've not seen an increase in the number of people treated. Look, you were a statistician, specialising in 2 areas, one in labour, one in health. How is that possible?
It's pretty much just the bureaucracy and the weight that must be going in there, Julie, because, over the last 12 months now, since the Labour government had come in, that target of around, they were aiming, say, to get back up to 90%, is hovering around 60%, they haven't moved. They're talking of a 2.8% real terms increase, so that's above inflation. But you've got to remember the population's growing and all the migration that's coming into the country, and people tend to get sicker as they get older.
Yeah, so and we are getting older.
Yeah, and if you look at the population 60 and over or 75 and older, that's going to grow over the next 4 or 5 years as well. That's going to continue to grow. So over half of the real terms increase is going to be eaten up straight away just by population growth. So that's not going to go straight into...
Yeah, it's not going to improve care for everyone else. And that's because that baby boomer generation, a massive big bulge in the population who are reaching the age when they're going to need a lot of health care.
It totally, and this is only going to get worse. So we talk about the money now. I know the Reform Party have got their Doge and they're trying to cut waste. Ultimately, they've talked about reforming the NHS, Julia. Parties are going to need to do that. I think the one thing with the NHS that's quite clear is it's a political hot pot and a political football.
Yeah.
All parties kind of need to come around the table and come up with a new way of running healthcare in the UK.
Well, the criticism always, they'll say, like Nigel Farage, the Reform leader, they'll say, well, he wants to privatise the NHS. Well, no, he wants to, not like America, he wants to move to an insurance-based policy for healthcare provision, which is what's used in pretty much every other country in the Western world and provides much better care, better outcomes, you're more likely to survive cancer, heart disease, diabetes, and you get treated quicker. So I'm not entirely sure that that's the spade to bash them over the head, but that they think it is anymore.
Well, no, and the good thing about, when you've got different countries doing different things, you copy something that works somewhere else. And I don't see anywhere around the world where anybody copies what we do.
This will never kick Cuba. No, this will never catch on. Jamie, I know also, we spoke to you so many times that over lockdown, talking about health statistics, someone who could actually crunch the numbers and tell us what the reality is and cannot be told, oh, you're just making it up. No, I'm a statistician, I know my stuff. But you've also spent a lot of time dealing with the labour statistics, and we quoted some of the statistics you had provided yesterday in terms of the jobs that have simply disappeared from our economy. Latest stats suggest 250,000 jobs have gone since the tax-raising budget just last autumn announced by Rachel Reeves. She's on her feet right now delivering her spending review. Reliably informed by Peter Carball, who's listening to it, that we haven't actually got anything of note yet. So, guys, you're not missing anything. When we do, we'll hear from him. But where did 250,000 jobs just disappear, Jamie?
Yeah, and it's getting worse over the last month. Nearly half of that has just come in 1 month alone. And it's quite clear that the jobs tax, the national insurance hikes have seen that increase. But what's quite interesting, Julie, that's the headline number.
Yeah.
If you actually start looking in terms of what types of jobs are being lost, well, the biggest fall is in hospitality. So obviously people can't afford to keep the workers on. But more importantly, people probably aren't going out as much. So people will be laid off as part of that. We are seeing some increases in the economy as well, though, Julia. So health and social care seeing an increase, obviously to try and get these waiting lists down. But if public sector employment's going up and private sector employment's going down, well, you've got to get the tax from the private sector to pay for a public sector. And that's the important thing here, that you cannot have a functioning economy. And Rachel Reeves talking about her spending plans today, if you've got less tax coming in from the private sector to fund the public sector. That's the conundrum and the thing that's not really, when you look at those headline figures, that's what's not really
more jobs. And again, we know that people in the public sector pay tax as well, but crucially, their wages have been ultimately paid for by the private sector. Not that it isn't a symbiotic relationship, because, of course, if we didn't have schools and hospitals and roads and things like that provided by the public sector, private sector companies wouldn't be able to create those jobs.
No, and it's often something I'm told as well, where public sector work. I worked in the public sector. Yeah, they do pay tax, but ultimately the government needs to tax the private part of the economy first
to pay for
get that
bits.
Money to pay for them. So it's pretty much just giving a bit of the money back that they've had from the private sector in the first place.
But we ain't getting growth, and we are not getting a boost to the economy and everyone's lives getting better unless we boost the private economy, not just spend more and more money on public sector jobs. Jamie Jenkins, so appreciate you joining us. Thank you very much indeed. He's a former ONS statistician.